What does a coat hanger and a hairdryer have in common with a headache? Well, in this video, I'm going to show you. Sometimes headaches can happen and they can be really annoying. I'm an acupuncturist and a Chinese herbalist, and I found these two things around the house that can easily help to stop pain. I'm going to show you in this video how they can, and I'm also going to give you some acupressure points you can use for yourself to stop headaches. So one of the most common causes of headaches can be musculoskeletal tension. So that just simply means tension of your muscles. And what this coat hanger kind of massage technique does is it can get right behind in your rhomboids. And that's the muscle that goes from your spine, between your spine and your shoulder blades. And that's the pesky, annoying muscle that can often get tight from us doing things like typing, from using our iPad or our phone and hunching over. So see how I just instantly grab this device. As soon as my two hands come together, I have to kind of hunch together like this, and our shoulders hunch up. And even that's not making me feel very good. And how can we reach out behind our rhomboids? It's really hard. So if you don't have a massage therapist handy around your home and you've got a headache, give this a try. So what you need is a coat hanger that's wooden. This has got a little bit of give in it, a bit of bounce. You can kind of hear that little sound that it's making as I push it up against my hand. So I would recommend you practice on your hand first. So you're just letting it bounce. And all I'm doing is letting the momentum of this coat hanger by my hand, just giving that nice sort of wrist action like that. I'm not... Oh, I've snapped it in half, exactly. I'm not purposefully putting too much force on it. Let me just get another one. Right. So I do have another one. So the point is that if you just do it like that, very naturally, you'll get a bouncing sort of sensation on your hand and it doesn't hurt. Okay, so check it, test it on your hand first, and then just put that on your back. And you basically just want to go in the muscle, which is in between your spine and your shoulder blade. And then you want to come on to here, which in Chinese medicine, this is your gallbladder channel. There's a point here called gallbladder 21. This is your trapezius muscle. And you can actually just do it right on the top there. So lovely, so relaxing. Now, this is a point that you generally want to avoid if you're pregnant. On the top of your shoulder blade one, the gallbladder 21, but you can still do the one behind your shoulder blade there. So you want to kind of do this on there for about that amount of time, 30 seconds to a minute. And you should feel a little bit of movement there in your muscles, that they're not as tight as they kind of were before. Your headache might still be throbbing, and that's okay. This is one way to kind of get blood flow, kind of getting it started. We're going to go through some points that you can use on your head in just a minute. So another thing you can try to stop pain is to apply heat. So what heat does is it makes blood vessels expand. And you can use a hot pack, if you've got one, a wheat bag, something like that. But if you don't have one of those, you can also use a hairdryer. Now, I don't have this plugged in, but what you would do is you would just blow that hairdryer onto the spots where the pain is. So particularly if you know that your back is sore, you can just blow the hairdryer simply onto those areas. Be careful with a hairdryer that you don't set fire to anything. Just use the same precautions that you would when you're drying your hair, okay? Use common sense. But you don't need to apply the heat for too long. You can apply it until you just get redness on your skin. The kind of heat that produces from a hairdryer is more like an infrared kind of heat. It's a dry kind of heat. And it's a little bit different to getting in the hot shower. But all kinds of heat, what they do when you get a redness on your skin is that's instigating your body to think as if it's burned, because it's a first degree burn, which is a redness, and then it starts releasing painkillers into your system, your own body's natural painkillers, and that can assist you to stop the pain. And that's how heat kind of works. By one is kind of tricking your body into thinking that it's being burned, and secondly is to make blood vessels expand, so more blood coming into the area, particularly for headaches, is kind of how we treat headaches. In a lot of Western medicine in the UK, they add caffeine tablets into their headache medicines. So in paracetamol, for headaches, they often put caffeine in that. Why would they do that? Because what caffeine does is it expands blood vessels. So sometimes a headache can be caused also by a lack of caffeine. Your body's used to having a certain amount of caffeine and then you don't have it. So what happens is the blood vessel used to being a bit bigger and they suddenly shrink back to how they normally were when you don't have the caffeine. And so that can just last a couple of hours or a few days, depending on how much caffeine you have, how long those withdrawal kind of symptoms last for. So you may need to just kind of wait until your body gets over that. I'm not suggesting go and have some caffeine tablets, but just using that as an example to say that caffeine is used as a headache medicine tells us a lot about how headaches are caused. So by opening up more blood flow to your head, you're generally going to reduce the headache. So how could we do this naturally? And why wouldn't you want to take a caffeine tablet? Why wouldn't you want to take a Panadol or some kind of Western medicine? Well, sometimes you've maxed out the capacity of your body to take those medications. I deal with patients all the time that have chronic pain and they are already taking medication and they can't take any more. Or they simply don't want to take it. They're trying to be more natural. They don't want the side effects of those things. So these two things you can try for free. Just simply the cost of a hairdryer and a hot coat hanger. You probably have those things around your house easily already. The other thing you can try is completely free, and this is some acupressure points you can use. So I'm going to give you a couple of points on your head. So one's called Tai Yang and the other one's called Yin Tang. So this one, Tai Yang, is at the side of your head, right in your temples, and you have a big muscle here called temporalis, and you can kind of press that, and you can use a circular motion to kind of massage in there. You can also use Yin Tang, which is this one in the middle. So you can push up and squeeze. So you can kind of just give that a squeeze. I'm going to get a big red face from doing this. You're basically just squeezing the little bit of skin between your eyebrows. If you press the wrong point with acupressure, it's not like, oh, this point turns the headache on and this turns it off. That's okay, right? It's not going to be a big deal if you don't press exactly the right point. But most of the time, the points that are right to be pressed tend to feel sorer than other areas on your body. So the last one I want to give you is a little thing on your hand that you can use. So you can press these points on your hand to kind of alleviate pressure. Now, which point would you use? Simply the most sore point. So to cut through the theory of Chinese medicine, you can simply just press on your hand in between these two areas and try to find the most sore point, the point that feels the most sore to you. So you can kind of press on here on the back of your hand, in between the two bones. Pressing on bone generally hurts, so don't press on the bone. And you also have this point here called large intestine 4 that's commonly used. So right on your thumb there, in between your thumb and your index finger. So it's actually on your index finger side, and that's a very common point. A lot of people massage it, or they say massage the little ball there. It's not quite exactly that, but you're in the right vicinity if you're kind of doing this to your thumb area. So I hope those exercises have been useful and helpful to you.